Again, I want to thank IFPRI for including me. The overall, I think, have been superb sessions. I was asked by the organizers not to deviate very much from my prepared comments, but I'm not sure I'm going to behave because I've been taking copious notes. But anyway, this has been a wonderful opportunity. I've run into people I haven't seen in a number of years, and it's a bit like deja vu because as you think about agriculture and nutrition, it's not a new concept, and some of the work that began at IFPRI and other places in the early 1980s were exactly this. We had a strong presence almost 20 years ago now at the International Conference on Nutrition sponsored by WHO and FAO. And somebody I ran into a little bit ago here, Joachim von Braun, I remember one of the comments he used to make when we began talking about ag and health was that ag nutrition, ag health, it's like a marriage. And I chuckle because I think if it was a marriage, it's been a pretty rocky marriage. But now we've had some marriage counseling, so maybe it's gotten a little bit better. But the reality is we don't have a lot of success stories in where whatever your goal is nutritionally, and by better linking ag and health or ag and nutrition, you've had significant impacts. Now let me anchor it back to what I was asked to discuss, which is what have we learned from what is listed here as high-income countries. We know there's now a global face of nutrition. Side by side, there are the classic problems of undernutrition with overnutrition, chronic diseases. And regrettably, the ink was not even dry on the Millennium Development Goals when we knew we were having a real problem in chronic diseases, diet-related chronic diseases in developing countries. I understand why the MDGs didn't deal with this. They wanted to focus on undernutrition. But back in when Gro Brundtland was still Director General of WHO, there's a clear focus on in the poorest countries in the world. We knew we were seeing problems of chronic diseases, obviously overweight and obesity and a lagged effect on diabetes and other chronic diseases. So it's a bit of a missed opportunity. Where do I think we need to go forward? I think given the double burden of disease, there are some challenges. It's not the same as what we've learned in dealing with undernutrition. In part, we have a huge urban problem. And Linda, your point, well taken, where we at Tufts are working in partnership with a number of developing countries, in China, specifically in Shanghai, in some urban areas of sub-Saharan Africa, where we're seeing increases in chronic diseases. So the urban approaches are not very well developed. And I'll throw a question out to the group. I have yet to see a countrywide approach, a national approach to preventing overweight and obesity that's been successful. I'd love to be proven wrong. And I tend to, when I deal a bit with policy officials, because there's a tendency to look at, let me use the example of what's the equivalent of vitamin A supplementation, but as a treatment to prevention of obesity, and I don't believe it exists. I think what we're looking at, and this is where ag nutrition comes in, is a multi-sectoral approach for chronic diseases. And I tend to refer to it as a large puzzle with 1,000 pieces. Some of the pieces larger than others, but unless you have all the pieces, the puzzle is not complete. Several people have talked about a policy focus, and I had the honor of co-chairing in the United States the National Nutrition Summit in 2000 with the then Surgeon General David Satcher, and we were unequivocal that the foundation of good health and good nutrition is food security. And I get a little bit concerned about some fuzzy thinking in the public health community where you start getting policy suggestions, not you, Patrick, policy suggestions that maybe we should make food more expensive and people would eat less. Well, so you get where I'm going on that one. But it occurred to me that we've been talking about policies, but not really very much about consumers. And let me take the U.S. because back in 2007 with Richard Deckelbaum, I published a book called The Nation's Nutrition. What did we learn post-World War II up until around the year 2000? And what did people want? People in the United States, adults, what did adults want in the United States post-World War II, vis-a-vis the topics we're talking about? They wanted higher income, they wanted more variety in the diet, and they wanted more leisure time. And we've summarized a lot of quantification on that. A lot of people in the United States and OECD countries have gotten what they've asked for. And so as we begin thinking about, well, what are the implications for healthy lifestyles, diet, and physical activity, unless you think about taste as the basic motivator and think about how do we get people to demand tasty foods that they can afford and that are accessible, I think we'll continue to be unsuccessful in some of the new challenges. Having worked in U.S. government as a policy official, I find policies a very imprecise way of changing behaviors. I think you need an enabling policy environment, but I think we have to collectively do more than that. The challenges are daunting, and I do get concerned when people throw out suggestions. A lot of spirit of full disclosure, I am at the moment working in both Asia and Sub-Saharan Africa on agriculture nutrition linkages as a way of improving nutritional status both over and under. And lo and behold, let me give one example, this is my last, the issue of, well, let's engage in nutrition education. And I can tell you based on evidence, we will continue to be ineffective on what is broadly called nutrition education if we use the traditional paradigms. Because messages like eat well, reduce your fat are meaningless to consumers because that's not what consumers do. Eat less fat, you may take the skin off chicken, bring an apple to work. Those are specific behaviors. And I think there's a body of delivery science that's needed in addition to policy. But we have to invest in this. And I said it was my last. Well, let me just say on healthcare cost, I think the U.S. as a nation has done abysmally in investing in preventive health care. We're probably second to none in our technology around medical care. But if we had taken even half the time to think about a public health preventive measure, I think some of the problems we have, we wouldn't. And let me just leave it at that. Thank you.